everyone, good morning. Our group will be discussing about specific host defense mechanism. And this morning we will be diving into the topics of immunology, functions of the immune system, immunity, cells of the immune system, and humoral immunity. We will also talk about cell-mediated immunity, hypersensitivity and hypersensitivity reactions, autoimmune disease, and microbiology laboratory. Immunology is the scientific study of the immune system and the immune response. The immune system is considered to be the third line of defense. It is considered as specific host defense mechanism because it springs into action to defend against a specific pathogen that has gained entrance to the body. Antigens are molecules that stimulate the immune system to produce antibodies. Antibodies, on the other hand, are proteins produced by the immune system in response to antigens. Functions of the immune system. The immune system differentiates between self and non-self, which is something that is foreign, and destroys that of which is non-self. There are two major arms of the immune system. First is humoral immunity, and second is CMI or cell-mediated immunity. Humoral immunity involves the production of antibodies, and these antibodies plays a major role in it. On the other hand, cell-mediated immunity involves many different cell types that includes macrophages, T helper cells, cytotoxic T cells, delayed hypersensitivity T cells, natural killer cells, and granulocytes. Though antibodies may play a role in some of the cell-mediated immunity, they do not play a major role.
Immunity is the condition of being immune, resistant to a certain infectious disease. Acquired immunity is an immunity that results from the active production or receipt of protective antibodies during one's lifetime. So, an acquired immunity is an immunity you develop during your life. Under it, there are two kinds of immunity. An active immunity, which is an immunity you develop after being exposed to an infection or getting a vaccine, and passive immunity, which is an immunity you acquire from someone or something else. So if you look at the chart, under these two, they also have another two subtypes, which is the natural and artificial type. So a natural active immunity is one where when antibodies are made after exposure to an infection, and artificial, which is when antibodies are made after getting a vaccination. As for the natural passive immunity, antibodies are transmitted from the mother to the baby via the mother's milk, and for the artificial one, antibodies are acquired more from an immune serum medicine. A vaccine is defined as material that can artificially induce immunity to an infectious disease, usually after injection or, in some cases, ingestion of the material, such as oral polio vaccine. So, vaccination works by deliberately exposing a person to a harmless version of the pathogen or toxin to stimulate the person's immune system to produce protective antibodies and memory cells. What is an ideal vaccine? Number 1, it should contain enough antigenic determinants to stimulate the immune system to produce antibodies. 2, it should contain antigenic determinants from all the strains of the pathogen that can cause the disease. 3, lastly, it does not cause disease in the vaccinated person. Earlier, we've already discussed about how vaccines work, but here is a more visual understanding of it. So first, a weak or dead form of the germ is introduced, which sparks the immune response to develop antibodies that remember the germ, hence known as memory cells. So this in turn leads to the body being able to produce the antibodies to fight off the germ if it invades again. There are different types of vaccine: inactivated vaccines, attenuated vaccines, toxoid vaccines, and subunit and nucleic acid vaccines. The process of weakening pathogens is called attenuated, and examples of attenuated viral vaccines are adenovirus chicken attenuation, and the vaccines are referred to as attenuated vaccines, which are basically weakened pathogens. For a more extensive list of examples of attenuated vaccine, here it is. So for attenuated viral vaccines, as we mentioned earlier, there is adenovirus chickenpox, varicella, measles, rubella, and so on. As for attenuated bacterial vaccines, there's BCG, typhoid fever, oral vaccine, and so on. Inactivated vaccines are made from pathogens that have been killed by heat or chemicals. These are much more easier and faster to produce, but are less effective and only produces a shorter period of immunity. Examples of inactivated viruses or viral antigens are hepatitis A, influenza, rabies. As for inactivated bacterial vaccines, there's anthrax, typhoid fever, which is the subcutaneous vaccine version of it, and Q fever. Then we have the subunit vaccine, which uses antigenic or antibody-stimulating portions of the pathogen to stimulate the production of antibodies against the protein of the pathogen. Examples: hepatitis B, Lyme disease, and whooping cough. Conjugate vaccines are bacteriocapsular antigens which are conjugated to molecules that stimulate the immune to produce antibodies against less antigenic capsular antigens. Examples of subunit vaccine are HIV and meningococcal meningitis. Toxoid vaccine are exotoxins that have been inactivated by heat or chemicals, which are then injected to stimulate the production of antibodies that neutralize the exotoxins of the pathogen. So, examples of toxoid vaccines, not subunit vaccines, are diphtheria, tetanus, and commercial antisera. There is also DNA vaccine, which is a particular gene from a pathogen which is inserted into the plasmids, which will be injected into the skin or muscle tissue. So this gene will direct the synthesis of a particular antigen. Once the antigen turns out copies of the protein, the body produces antibodies directed against the protein. Lastly, we have autogenous vaccines, which are prepared from bacteria isolated from localized infection. Pathogens are killed, then injected into the same person to induce production of more antigens. Major cells involved in immune responses are T lymphocytes, also known as T cells, B lymphocytes, B cells, NK cells, which are a category of lymphocytes, and macrophage. So the cells involved in immune responses originate in the bone marrow, with 3 lymphocytes originating from the lymphoid cells of the bone marrow. The 2 major types of T cells are helper T cells and cytotoxic T cells. Helper T cells are also known as T helper cells, TH cells, and CD4 cells. Its primary function is the secretion of cytokines. Cytotoxic T cells are also known as T cytotoxic cells, T cells, and CD8 cells. So the primary function of it is to destroy virally infected host cells, foreign cells, and tumor cells.
Immunity. Humoral immunity. In humoral immunity, special glycoproteins called antibodies are produced by B cells in response to antigens. In many cases, these antibodies are capable of recognizing, binding to, and inactivating or destroying specific pathogens. A closer look at antigens. Antigens stimulate the immune system to produce antibodies, the substances capable of stimulating the production of antibodies are said to be antigenic. A bacterial cell has many molecules on its surface capable of stimulating the production of antibodies. These individual molecules or antigenic sites are known as antigenic determinants. Individual molecules that stimulate the production of antibodies are referred to as antigenic determinants or epitopes. Some small molecules called haptens may act as antigen only if they are coupled with a large carrier molecule such as a protein. Then, the antibodies formed against the antigenic determinants of the hapten may combine with the hapten molecules when they are not coupled with the carrier protein. Processing of antigens in the body. For antibodies to be produced within the body, a complex series of events must occur, some of which are not completely understood. It is known that macrophages, T cells, and B cells often are involved in a cooperative effort. T-dependent antigens. The processing of T-dependent antigens requires the participation of helper T cells as well as macrophages and B cells. T-independent antigens. Helper T cells are not involved in the processing of T-independent antigens, only B cells are required. The cells that secrete antibodies are called plasma cells. They are derived from B cells. The initial response to an antigen is called the primary response, whereas a subsequent response to the same antigen is referred to as the secondary, anamnestic or memory response. When the antigen is used up, the number of antibodies in the blood declines as the plasma cells die. Other antigen-stimulated B cells become memory cells, which are small lymphocytes that can be stimulated to rapidly produce large quantities of antibodies when later exposed to the same antigens. A closer look to antibodies. Antibodies are usually very specific, binding only with antigenic determinant that stimulated their production. An antibody is an immunoglobulin having particular specificity for an antigen. A monomer resembles the letter Y. It consists of two heavy chains, two light chains, two antigen binding sites, and an Fc region. The 5 immunoglobulin classes are IgA, IgD, IgE, IgG, and IgM. When an antibody combines with an antigen-antibody complex is formed. Antigen-antibody complexes are capable of activating the complement cascade, resulting in, among other effects, the activation of leukocyte, lysis of bacterial cells, and increased phagocytosis as a result of opsonization. Thus, acute extracellular bacterial infections are controlled almost entirely by AMI. How antibodies protect us from pathogen and infectious diseases. A pathogen has entered a person's body and has started producing a toxin. That person's immune system responds by producing antibodies against the toxin. Such antibodies are called antitoxins. Once produced, the antitoxins recognize, bind to, and neutralize the toxin molecules so that they can no longer cause harm. A person has received a vaccine containing attenuated virus. The vaccine stimulates the person's immune system to produce antibodies against adhesin molecules. Should that same virus enter the person's body again, those antibodies will adhere to the adhesin molecules, making it impossible for the virus to bind to the host cells. If the virus is unable to bind to the appropriate host cell, it is unable to enter the cell and the person is protected from infection with that virus. A person is infected with a pileated bacterium. That person's immune system responds by producing antibodies against the pili. The antibodies bind to the pili, making it impossible for the bacterial cells to bind to tissue. If the bacteria are unable to attach to tissue, they are unable to cause disease. A person is infected with an encapsulated bacterium. That person's immune system responds by producing antibodies against the capsular polysaccharide molecules. The antibodies attach to the capsule. This makes it possible for the phagocyte to bind to the encapsulated bacteria. Cell-mediated immunity. Antibodies are unable to enter cells, including cells containing intracellular pathogens. Fortunately, there is an arm of immune system capable of controlling chronic infections by intracellular pathogens. It is called CMI, a complex system of interactions among many types of cells and cellular secretions. Response. Natural killer cells. Cytotoxic T cells and NK cells kill foreign cells, host cells infected with viruses or bacteria, and tumor cells. NK cells kill target cells, including foreign cells, host cells infected with viruses or bacteria, and tumor cells. Although NK cells' activity is not dependent on antibodies, NK cells have receptors on their surface for the Fc region of IgG antibodies. These receptors enable the cells to attach to and kill antibody-coated target cells. This is known as antibody-dependent cellular cytotoxicity. Once attached to an antibody-coated target cell, the NK cell inserts a molecule called perforin into the cell membrane of the target cell, creating an opening through which cytotoxic granules called granzymes are injected.
And next, hypersensitivity and hypersensitivity reactions. Hypersensitivity refers to an overly reactive immune system. So this is the undesirable reaction, including allergies and autoimmune. Sensitivity reactions are divided into two general categories, which are the immediate type and delayed type, depending on the nature of the immune reaction and the time required for an observable reaction to occur. Immediate type hypersensitivity reactions occur from within a few minutes to 24 hours after contact with a particular antigen. There are three categories of immediate type hypersensitivity reactions, referred to as type 1, type 2, and type 3 hypersensitivity reactions. A delayed type hypersensitivity reaction usually takes more than 24 hours to manifest itself. Delayed type hypersensitivity reactions are also known as type 4 hypersensitivity reactions and self-mediated reactions.
Type 1 hypersensitivity.
Type 1 immediate hypersensitivity is probably the most commonly observed type of hypersensitivity. People who are prone to allergies are described as being atopic. They produce IgE antibodies when they are exposed to allergens, so classic allergic responses like hay fever and food production, IgE antibodies bind to the surface of basophils and mast cells. The granulation of the basophils and mast cells occurs when allergen binds to these IgE antibodies. His type 1 hypersensitivity reactions may either be localized or systemic. In localized anaphylaxis, the reaction is limited to a specific target tissue or organ, whereas in systemic, it is more often serious or tends to be more severe condition than localized anaphylaxis.
Latex allergy.
In most cases, latex allergy develops after many previous exposure to latex. Latex can trigger any of the following three types of reactions. The first one is irritant contact dermatitis. So this is the most common reaction to latex products. The affected individual experiences dry, itchy, irritated areas on the skin. Second is allergic contact dermatitis. So this results from exposure to chemicals added to latex during harvesting, processing, or manufacturing. And latex allergy. So this is an immediate type hypersensitivity that can be more serious reaction to latex than irritant contact dermatitis or allergic contact dermatitis. Subsequent exposure to latex can then trigger mild to severe reactions. Certain medication may reduce the allergy symptoms by complete latex avoidance, although quite difficult.
Allergy skin testing and allergy shots.
A skin test is considered positive if the test result will show swelling and redness at the site that the allergen was introduced into the skin. Once the offending allergen is identified, immunotherapy may be accomplished. Allergy shots result in the production of Ig-blocking antibodies which prevent the allergen from attaching to basophil or mast cell-bound Ig.
Type 2 hypersensitivity.
Type 2 hypersensitivity reaction are cytotoxic reactions, meaning that the body cells are destroyed during these reactions. In a cytotoxic reaction, the antibody reacts directly with the antigen that is bound to the cell membrane to induce cell lysis through complement activation. These antigens may be intrinsic or self as in autoimmune reaction, or extrinsic or non-self. Cytotoxic reactions are mediated by IgG and IgM.
A typical type 2 hypersensitivity reaction might follow this sequence. Step 1. A particular drug binds to the surface of a body cell. Step 2. Anti-drug antibodies then bind to the drug. Step 3. This initiates complement activation on the cell surface. Step 4. The complement cascade leads to lysis of the body cell. Type 3 hypersensitivity.
Type 3 hypersensitivity reactions are immune complex reactions So IgG and IgM bind antigen, forming antigen body or immune complexes. This activate complement, which results in polymer-mononuclear neutrophils, chemotaxis, and activation. PMN, the release tissue-damaging enzyme, tissue damage present in autoimmune diseases and chronic infectious diseases, in part to immune complex reactions. So one of the type 3 hypersensitivity reaction is serum sickness. So this is allergic reaction following exposure to foreign proteins. So the resultant immune complex of the patient's antibodies bound to the foreign protein is deposited in small vessels and stimulates the complement cascade and hence an inflammatory reaction. So the type 4 hypersensitivity reaction are also known as the delay type, or self-mediated immune reaction. So this is called the delay type because it takes 2 to 3 days for the reaction to develop after exposure to the particular substance. An example of this reaction is a positive TB skin test, either tuberculin or purified protein derivative protein extracts prepared from Mycobacterium tuberculosis cultures. So it is injected intradermally into a person.
The following events occur to produce positive reaction. Step 1. Within 2 to 3 hours after injection of the PPD, there is an influx of polymorphonuclear cells into the site. Step 2. This is followed by an influx of lymphocytes and macrophages while the PMNs disperse. Step 3. Within 12 to 18 hours, the area becomes red and swollen. Step 4. The erythema and the edema reach maximum intensity between 24 to 48 hours. Step 5. With time, as the swelling and redness disappear, the lymphocytes and macrophages disperse. TB skin test.
A positive TB skin test indicates that an individual has been exposed to mycobacterial antigens. That individual may or may not have active tuberculosis. So a positive TB skin test result may indicate any of the 5 possibilities. Number 1, the person has active tuberculosis. Had tuberculosis at some time in the past and recovered. The person was infected with mycobacterial tuberculosis at some time in the past, but the organisms were killed by the person's host defense mechanism. If the person currently harbors live mycobacterial tuberculosis organism but does not actually have tuberculosis, and if the person had received BCG vaccine at some time in the past. Next is the autoimmune diseases. Autoimmune disease results when a person's immune system attacks the person's body tissues as if they were non-self or foreign. So, the natural defense system can tell the difference between your own cells and foreign cells, causing the body to mistakenly attack normal cells. This may occur with certain tissues that are not exposed to the immune system during fetal development, so that they are not recognized as self. Such tissues may include the lens of the eye, the brain and spinal cord, and sperm. Autoimmune diseases can be classified as organ-specific and non-organ-specific. So in organ-specific disorders, this is directed mostly against one organ. So here are the examples of organ-specific. And non-organ-specific autoimmune diseases involve the skin, kidneys, joints, and muscle.
Hello, my name is Mamaiti and I'll be covering immunosuppression. Immunocompetent means a person's immune system is functioning properly, but when it is immunosuppressed, immunodepressed, or immunocompromised, their immune system is not functioning properly. Immunodeficiencies may either be inherited or acquired. Acquired immunodeficiencies are caused by drugs, irradiation, certain infectious diseases, or old age. Inherited immunodeficiencies are caused by deficiencies in antibody production, complement activity, phagocytic function, or NK cell function. Complement activity refers to the complement system, which is a part of the immune system that aids in the ability to destroy pathogens. NK cell function refers to the natural killer cells that are activated to control viral infections. The most common cause of immune deficiency worldwide is malnutrition. Examples of inherited immunodeficiency diseases are severe combined immune deficiency, which is the deficiencies of B cells or T cells or both, DeGeorge syndrome, which is the congenital absence of the thymus and parathyroid glands, causing frequent infections and delayed development, and Wiskott-Aldrich syndrome, which is the deficiencies in B cells, T cells, monocytes, and platelets, which causes bleeding, recurrent infections, and eczema. Some people are born lacking the ability to produce protective antibodies. Agamma-globulinemia is the abnormality of no gamma globulins in the blood due to the inability to produce protective antibodies. A person is very susceptible to infections by even the least harmful microorganisms, but a successful treatment is bone marrow transplant. Hypogammaglobulinemia is the production of too few antibodies. This means a person cannot recover from infectious diseases as easily as most other people because the resistance to infection is lower than normal. Bruton's hypogammaglobulinemia is a hereditary disease characterized by the low count or absence of B cells, which leads to severe antibody deficiency and recurrent infections. I will now discuss the immunology laboratory. Immunologic procedures include tests to diagnose infectious diseases and immune system disorders, determine tissue compatibility for organ and tissue transplants, and detect and measure various serum components. Immunodiagnostic procedures, or IDPs, are laboratory procedures that use principles of immunology to diagnose diseases. They are designed to detect either antigens or antibodies in clinical specimens. Serologic procedures, or IDPs, performed on serum specimens in the blood. I will now elaborate on the detection of antigens versus antibodies. The detection of antigens indicates that a particular pathogen is present in the patient, providing direct evidence that the patient is infected with that pathogen. This provides the best proof of current infection, but the procedures are not available for many infectious diseases. The reagent used to detect antigens contains antibodies and is called an antiserum. The detection of antibodies that is directed against a particular pathogen indicates indirect evidence of infection with that pathogen. The presence of antibodies to a particular pathogen may represent three possibilities, and that is present infection, past infection, or prior vaccination against that pathogen. It takes a person 10 to 14 days to produce detectable antibodies, meaning even if the person is infected with a particular pathogen, the antibodies will not be detectable for about 2 weeks. The value of antibody detection procedures can be improved by IgM antibodies or via the use of paired sera, that is, acute and convalescent sera. The reagent used to detect antibodies contains antigens, which is usually a suspension of the dead pathogen. I will now be discussing the detection procedures and tests for antigen and antibody. The tests used to determine that antigen-antibody reaction occurred include agglutination, which is the clumping of cells or latex particles, precipitin procedures, which involves the production of a precipitate, immunofluorescence procedures, and enzyme-linked immunosorbent assays, which involves the production of a color. For antigen detection procedure, the clinical specimen mixes with an antiserum. A positive test result is the formation of antigen-antibody complexes, which shows that the antigen is present in the clinical specimen. A negative test result is if there is no visible antigen-antibody reaction. For example, a drop of cerebrospinal fluid from a meningitis patient is mixed with a drop of antiserum containing antibodies against Haemophilus influenzae. A visible antigen-antibody reaction is an evidence that the patient's cerebrospinal fluid contained Haemophilus influenzae antigens. The patient's condition is diagnosed as meningitis caused by Haemophilus influenzae. For antibody detection procedure, the clinical specimen mixes with a suspension of a particular antigen. A positive test result indicates that antibodies reacting against the pathogen are present in the clinical specimen. A negative test result is when there are no antibodies against the pathogen present in the specimen or no visible reaction observed. For example, a drop of serum from a patient suspected of having Lyme disease is mixed with a suspension of Borrelia burgdorferi. Borrelia, Borrelia, burgdorferi, Burgdorferi. This is the causative agent of Lyme disease. A visible antigen-antibody reaction is evidence that the patient's serum contained antibodies against Borrelia burgdorferi. The patient's condition is then diagnosed as Lyme disease. Radioallergosorbent test, or RAST, is an alternative or addition to intradermal skin testing to determine the allergens to which a person is allergic. It measures the levels of allergy or immunoglobulin E antibodies produced when the blood is mixed with a series of allergens in a laboratory. Skin testing as a diagnostic tool. This is another type of immunodiagnostic procedure that is performed in the patient rather than in the laboratory. Antigens are injected intradermally or subcutaneously. It determines the allergens to which a person is allergic, and the TB skin test is a commonly used example. Procedures used in the diagnosis of immunodeficiency disorders. Tests performed in the immunology laboratory assess a patient's immune status and evaluate immunodeficiency disorders. It includes tests to diagnose B-cell deficiency states or humoral immunodeficiencies, cell-mediated immunodeficiencies, combined humoral and cell-mediated immunodeficiencies, phagocytic deficiency states, and complement deficiencies.